Is it safe to put filler on top of a chin implant? Hello, can you please tell me if it is safe to put filler on top of a chin implant?
Thank you for your question. You submitted your question without a photo, and you're asking a straightforward question: is it safe to put filler on top of a chin implant? Well, I can certainly explain to you what I explain to my patients who ask similar questions in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Placement of chin implants is fairly routine in our practice, as well as the use of fillers that is very effective in creating similar type of outcomes in a method which is called structural volumizing. So the reason I want to elaborate further on this question, besides just saying yes or no, is that there's some important issues to really resolve so that you can get a predictable and safe outcome. So number one is that a chin implant is placed at a particular level of the bone. It's called subperiosteal, which means that there's the layer of very tough tissue on top of the bone called the periosteum. And the implant is placed between that tough tissue, periosteum, and the bone, and fixated, and basically a capsule eventually forms around the implant. When you're placing injectable fillers, you have options as to the levels in which those injectable fillers are placed. Now, one of the challenges that we have to also consider in your particular situation is whether or not the filler would actually make a difference. Sometimes when people have a chin implant and there's a very much of a tight space between the skin and the implant, then the placement of filler will not likely make a dramatic change. So that's something to be very mindful of, especially when you're placing the filler at a deeper level. Now, if there is some soft tissue, like the area below the skin, where there's a certain room for movement, then placing the filler in that space is feasible. I think that the take-home message is the safety is in minimizing the possibility of infection. The implant itself does not have a blood supply. Therefore, when you are placing a filler from the skin through the skin, you have to be sure that the bacteria that's on the skin surface does not have an opportunity to go in at the same level of the implant by practicing as much sterility as is appropriate. When we do structural volumizing in our practice, what we are doing essentially, whether there's a facial implant in place or not, we treat the procedure like surgery. So our preparation and everything is as if we were doing surgery, using different types of antiseptics such as something called betadine to make sure that the skin surface is as bacteria-free as is possible, employing very specific sterile techniques to place the filler using instruments such as blunt cannulas. And we're placing this material between the bone structure, or in your case, the implant, and the muscle. And that provides a really nice sculpting effect that creates a very natural look. Very often we'll also fill the soft tissue between that space and the skin. So the take-home message here is that the safety is there, but you have to be fastidious about the minimizing the risk of infection. There are times an indication to even put someone on an antibiotic just to cover those bases. But every case is individualized. So I think that the short answer to the question is yes, it is technically safe to put filler on top of an implant, but there is a potential risk by the nature of the presence of a foreign body on your anatomy to minimize the risk of infection so that you get a good and safe outcome. So I hope that was helpful. I wish you the best of luck. Thank you for your question.